I am back with another video. This video is going to be pros and cons to day shift and night shift. I've worked both shifts. I've been a daytime nurse and a night shift nurse. I'm kind of a recent night shift nurse because I went night shift around, it's 2022. It was like 2021 when I started night shift nursing. So yeah, without further ado, let's get into it and we can ask questions along the way here in the comments and go from there. Let's go. Okay, starting with day shift, the pros and cons to day shift. So for one, number one pro is time moves super fast. By the time you clock in, it is time to clock out, because in day shift, that's when you get majority of, new patients, new orders, got to go to CT, MRI, CAT scan, all kind of stuff in the day shift. It's like a constant moving no matter what. But at times it could be like, you feel like you can't get everything done in the shift because everything is moving so fast. So pros of day shift is time moves like that. Another pro to day shift is having a normal sleep schedule. You're able to have your hours, still go to bed at night from being up in the daytime, and you can kind of stay on a routine. However your routine is, you're able to get what you need done and get on and get off of work. Another pro with day shift for me, I believe this is pro number 3, is having the help of the doctors and family at the same time. Because in day shift, most of the attendings, they're around, they're close. If not, they all in their doctor's room. So any questions you need answered, if you need a quick order, if you need anything, you have so many resources to, okay, well, if I can't get a substitute, cool. If I can't get that done for the patient, let me call the caseworkers. Caseworkers are there. Okay, caseworkers there. Patient has surgery. 9 times out of 10, the surgery team and all of them are still there. So boom, you can call, ask questions. You have so many resources on day shift to where you're not having to try to just figure it out, because again, everybody's at work, 9 to 5, whatever you do, time frame, everyone is there to help you. Having pick crew team, people to come in and place IVs if you can't get them, because I've had time when patients have like 4 to 5 different things that have to run at the same time. And all nurses know, when you look and see if the medication is compatible, it is music to your ear when you see the green check mark. When you get the red X, you have 5 different things and nothing is compatible, we need more IVs. And depending on how long something runs, maybe antibiotic runs for an hour, another one for 4 hours, another one you can maneuver, but it's quicker to, if you can, maybe get the other IV access. But what the issue coming to play is when you have a patient that is a very hard stick. So if it's day shift, you have your pick crew that can come about. They can give a patient a midline, extended dwell. If they need a pick line, they're able to come there and help, because those resources are not there at nighttime. So you're able to get what you need done. It's also a good thing, a pro with day shift, when you have family that are coming to visit, and say you get a patient that come in that's altered or can't really answer questions for you, the family's there with them and they're able to help answer some of those questions or kind of give you a baseline to the patient and how the patient is, so you have like some normalcy to go off on, because you will have patients that are altered, some detoxing, some in, only alert oriented to self. So family's kind of there to help maneuver. Or if you have a patient that's coming in the middle of the day and you're trying to ask them, well, what meds did you take today? Did you take your meds today? Sometimes they just may not know, like they're trying to deal with getting better, and family's able to say, no, they took all their morning meds today. So if you have metoprolol that you have to take 3 times a day and you just came in, I ain't trying to double dose you if you've already taken that med today. So that's also a good pro to day shift nursing. I'm going to go ahead and throw in the cons of day shift nursing so videos won't just be so tedious and long. Cons of day shift nursing is the fact that, I'm just going to say it, y'all, that you do deal with some families, because you sometimes have families where you're climbing over people in the room to take care of the patient. Not only that, when you're it's family, so they're concerned. So they're like hands-on trying to figure out what's going on. But it's as simple as you go in there to spike a saline bag. You got 20 questions coming to you at one time. And you're like, yes, what? And it's like, hold on, let me just get the patient situated and I can answer all of y'all questions. On top of that, coming and going, and as a nurse, when you're like, get your time to chart, and you have family chasing you around or seeing you sitting at the desk to ask another question. And it's understandable. They're concerned. They want to know, but that's another con of day shift, because it's like, okay, just let me get this done and I can come answer whatever needs to be answered. Another con to day shift nursing is the fact that new orders come constantly all throughout the whole 12-hour shift. And everybody know at my hospital, 3 p.m., if you got lunch, if you haven't eaten by 3 p.m., you can hang it up, because them orders are coming. And at 3 p.m., you may be having to start blood, hang platelets, get this IV going, get this the first dose of Zosyn, vancomycin, whatever. New orders are constantly coming. Then on top of the new orders, admissions. Then on top of that, everybody's at work. So it's CT, doctors, all of this coming in, and you're trying to time yourself getting in these rooms before the crowd comes. Plenty of times when I was a day shift nurse, I would come in and be with my patient. We get in the morning started, I'm doing an assessment, boom, doctor walks right in. Some nurses will say, that's the doctor, he finna wait, I don't care, I was already in here first. Me personally, when it comes to an assessment, if I started that morning and I know doctors do their rounds, I got 12 hours with this patient. Let me go ahead and just step to the side so the doctor can have the undivided attention, and I simply say, hey, I'll come back. But if I'm in the middle of giving a med, I'll finish my med pass, explaining everything, and I say, okay, cool, I'll come back, depending on who the doctor is, or if it's information that I need to hear too sometime, then I will stay back in the room and listen. Because at times when these patients are in the hospital room, you already know what's going on. They may be coming to give the patient an update. Meanwhile, I've already read it in the notes. That way, when the doctor get done, 9 times out of 10, your patients will have questions for you too when you come in. So that also helps at the same time, but it will push your time management back, because everybody know in day shift, time management has to be on point, because things are moving so fast. If you don't, you will be there after the clock still trying to finish. And who wants to do that when you got to be back up there in a couple of hours? So yes, on top of that, that is my overall just with the pros and cons to being a day shift nurse as far as time management skills, family being there, etc., so forth and so forth, so on, and the cons. So again, like, comment, subscribe. Going to be coming with more videos, and in my next video, we'll talk about night shift. And if you missed any of the other ones prior to, go back and watch, go back and share, go back and look. If you have questions, put them in the comments, and we're going to keep coming with more. See y'all.